Thank you, Dr. French, and thank you all, and especially the Epilepsy Foundation. I'm Rosemary Gathara from Kenya. Last year, I was at the conference in San Francisco where we presented the MKFAFA, Mobile Technology for Epilepsy Awareness, and we're so happy that you supported us, and happy to be here to give an update of what we've done since then. So, not sure how this works.
So it's the big green button. Yeah.
Great. So yeah, we got the $50,000 and we're so grateful that we could move ahead with our product. Why we needed the support that we came to request for is because of the epilepsy situation in Kenya. Like you can see, those are the figures. We have about 80% treatment gap. Most of the people with epilepsy in Kenya do not get the care they need. There are two main reasons. One, people don't recognize epilepsy as a medical condition. It's thought of as witchcraft or a curse, demon possession. The last place somebody will go is to a hospital. They try everything else before they get to a hospital. Then the second thing is that even if they went to a hospital, there are very few that offer epilepsy treatment. So those are the two challenges that we were trying to tackle. Or rather, when we say few offer the treatment, it's because we go around in a circle. They say we could put somebody trained to see the patients, but there are no patients to see. So we try to get the trained personnel in the health facilities and then get the patients to go there, but the patients need to know where to go. So that's why we came up with MKFAFA. It's not an app because we have a lot of phone use in Kenya. Like over 80% of people in Kenya will have access to a mobile phone, but it's a simple mobile phone, not a smartphone, and we don't have that much internet access. So MKFAFA uses text to get the information to the person so they can find different information, and I have a short video that will show you what kind of information they get. So when we came to the Shark Tank last year, we had a need. We needed the people, we had developed the platform, but we needed to get content onto the platform. We also needed to get the platform in a way that it could easily work and people could easily pull out the information from it. And we needed it in a language they can understand. English it's spoken in the urban parts of Kenya, but in the most of Kenya is rural, and people there speak Swahili, so we needed to do a lot of translation. Now, I have a short video that, not so short.
Epilepsy affects about 10 million people in Africa. In Kenya, the available statistics indicate a prevalence of 2%, which means about 1 million people live with epilepsy. For over 30 years, Kawe, in conjunction with its partners, have undertaken measures to try and solve various problems faced by people living with this condition. Kawe has identified two major problems that surround epilepsy. The first is lack of proper information to clear up the various myths and misconceptions surrounding this disease. Secondly, the limited access to proper treatment. The treatment gap is over 60%, which implies that the majority do not get adequate treatment and individualized care that they greatly need.
Even though we have been doing these oral awarenesses and trainings, they are not enough. We reach very few people by getting one-on-one oral conversations about epilepsy, and this has led to people still keeping their myths and misconceptions about epilepsy. And once in a while, we are able to get some space in the media where people we talk about these services.
I have a child who has been sick from age of 3. He fell ill one day at early in the morning, around 3. It's like to us he had fainted. At the beginning we didn't know what to do or what the problem was. By around 6 in the morning, he had come back to normal. But still we didn't know what the problem was. So we were referred to go to Kenyatta. We had a problem with Kenyatta because they did not tell us what the problem was. So he was admitted, and after 2 days he came out. But still we didn't know what the problem was. So with those many questions, we moved on seeking help wherever we could. I remember we consulted, we used herbal medicine, we did what, but nothing still happened. I met a friend who told me about the kawe. That was almost 3-4 years down the line. I attended clinic in Karen for about 2 years. Then I decided to move to a closer clinic, which is in Huruma.
To ensure that the society at large has the correct information and the myths surrounding this disease are dispelled, Kawe has undertaken various campaigns which includes roadshow awareness, local media campaigns, epilepsy awareness campaigns in our local communities like schools, and social media advocacy. Stigma and lack of knowledge about epilepsy is prevalent and is a major reason why people with epilepsy in Kenya do not get the help they need. This sparked off M-Kifafa. This is a mobile phone-based platform that is intended to inform the society about epilepsy. With 37.8 million Kenyans reportedly accessing mobile phones, we recognize that M-Kifafa will be a significant tool in reaching society both in rural and urban areas. The platform provides a wide variety of information ranging from what is epilepsy, what causes it, treatment, concerns about epilepsy, how to administer first aid, and what to do in an emergency. It also shows locations of the various epilepsy clinics around the country. The platform is simple to use by anyone, wherever they are at any time, regardless of age, gender, and social status. All a user would need is a simple phone and a phone network. Following the success of the M-Kifafa platform, other health organizations joined as partners to provide information on other health conditions, and Fafanuka was born. It will also be an easy way to source data used in demographic studies. Fafanuka brings epilepsy information to you conveniently in real time in your hands. This platform will undoubtedly make a difference not only to those living with epilepsy, but the whole society at a touch of a button.
A huge percentage of Kenyans, they have mobile phones. Fafanuka's mobile platform that is coming up will be very helpful because patients can get the information right on their mobile phones.
To ensure proper treatment and individualized attention is given to patients, Kawe works with the Ministry of Health and County Health Services to run community epilepsy clinics at primary health level, where well-trained clinicians and community health workers attend to patients, offer health talks, and the needed support geared towards informing the patients, their caregivers, as well as the general public.
I am a Kawe clinician. This is the Ruta Health Center. It's a public health center, but every Thursday there is room for patients with epilepsy where they are seen. So far we have about more than 4,000 registered patients. Kawe has helped the county governments to open at least 31 clinics around 26 counties in Kenya where epilepsy services are offered. We have healthcare volunteers who are trained first of all by Kawe. There are at least in every clinic there are 4 volunteers or community health workers. They go to the villages where they give out information about epilepsy that people may know and come to the clinics. That method has been used for a long time, since 2003. But we have started up a training program with the Kenya Medical Training Colleges, where we have come up with an epilepsy curriculum which will be used in the medical training institutions. It is still in progress, but we hope soon it will be complete and it will be out.
We've learned a lot. It has helped me shed off the fears that I had before coming to Kawe.
From Kawe, I work here at the Riruta Health Center, helping patients who come here to visit us on a weekly basis. When the patient first walks in, they have a seat, and then we ask them if it's their first time. Patients who are visiting for the first time, there is somebody who assists them to do the history. And those who are revisiting, or probably they're coming back for their refill, they're given first priority to pick up their drugs.
We store our files here, but we also have a plan to come up with an electronic way of putting information.
They pay for a small fee for consultation, like 100 shillings. After that, they come and see the clinician on duty who advises them on the change of medication and if there is a change or to increase, or they are doing well, or the whole part of their consultation. After that, then they come to me, whereby they pay for their prescription, which is always very affordable because they're able to live with a smile. They're given a prescription for 3 months, and after that they go pick up their medicine and off they go home. But there is a part, before they go through this whole process, there's a part where they have to, the guardians at home or the people who take care of them need to get information about this whole condition.
We would like to thank our partners, the Epilepsy Foundation, for the opportunity to participate in the Shark Tank competition and their generous contribution towards the realization of Mkifafa, now Fafanuka platform. Secondly, Safaricom and KCDF for providing technical and financial resources. The platform is complete.
So, thank you. That video showed what epilepsy services we are discussing. When you talk about epilepsy services, I think they are very different. When I attend a conference like this and hear what you discuss, like the EEGs, and we don't have much of that. It's basic treatment, a clinician diagnoses and provides a treatment, but even that is lacking. So, or rather, it's not as accessible as it should be. People don't know that it's available. So, we are very happy that we could get Mkifafa up, because then people can know. They dial on their phone and they're able to see where to go for the treatment. So our achievement since we were here last year, one is that we've been able to complete the content. Secondly, we translated it into the national language, which is Swahili. And third, as you saw in the video, we partnered with 3 other organizations that provide services for non-communicable diseases. That's heart disease, cancer, and diabetes. All these conditions are not very well known in Kenya, so we partnered with them. It's easier for us to do marketing for the platform. When we are a bigger group, then it's easier to raise the funds needed for the marketing. So the Mkifafa, we had to rebrand it, because Mkifafa is Kifafa is Swahili for epilepsy. But now with these other non-communicable diseases on board, we rebranded to Fafanuka, which is Kiswahili for to be enlightened. And now it includes other non-communicable diseases. Hopefully even more will join us, and we can get a more informed society. Then we've also produced marketing materials. I came with a few. I hope I'll be able to share with a few of you. And yeah, we are very happy I'm happy to be here, to be able to give this update, and thank you so much to the Epilepsy Foundation for the opportunity and the generous funding. Thank you.